Stroke thrombolysis, a revolutionary treatment transforming the landscape of stroke care. Stroke usually strikes suddenly without warning. Knowing the steps to take when it occurs is crucial. Within the first few hours after a stroke, a window of opportunity exists to administer a clot-busting treatment known as thrombolysis, which makes a difference between disability and recovery. Spare a few minutes to join us as we meet the dedicated healthcare professionals at Komfo Anokye Teaching Hospital who are on the front line, racing against time to administer this life-saving therapy. Professor Fred Stephen Safo is the head of the multidisciplinary stroke team at Komfo Anokye Teaching Hospital. He tells us more.
Hello, my name is Professor Fred Stephen Safo. I'm a neurologist at the Komfo Anokye Teaching Hospital. I want to talk to you about stroke thrombolysis. A stroke occurs when blood flow to the brain is blocked by a clot. So within a few minutes to hours, millions and millions of nerve cells will die if we don't find a way of restoring blood flow to the brain. So when these symptoms occur, they occur because the part of the brain that is not receiving blood is not doing its work well. And so these symptoms include loss of balance, loss of vision, you may have weakness of your arm or legs, and loss of speech. When you see any of these symptoms, you have to report to the hospital immediately. Ideally, within an hour or two, you must be in the hospital so that we can perform the necessary tests such as a scan of your brain to find out whether there's a blood clot or there's a bleed. If you find that there's a blood clot, then there's a new treatment available called thrombolysis. Here we will inject you with the agents called alteplase or tenecteplase, and then this medication will dissolve the blood clots and quickly restore the blood flow back to the brain. We've seen tremendous results with these treatments. A lot of patients who receive these treatments do not go back home with paralysis or a permanent disability. This treatment is life-saving, and so we want you to get to the hospital as soon as the symptoms of stroke start so that we can administer this life-saving treatment. Okay?
Now, let's listen to Dr. Chris Opong, Head of Emergency Medicine at Komfo Anokye Teaching Hospital. He tells us about the stroke algorithm and how to trigger the stroke code.
What happens when somebody has a stroke? Ideally, we will have to get pre-notified, and pre-notification means that we're going to receive an information or a notification from the ambulance team that has to bring the patient. When they inform us, we are going to activate the stroke code. And I'm going to talk about the stroke code. The stroke code is an algorithm that we normally have to follow when we have to treat a patient with a stroke. So people or the general public are supposed to be aware that whenever they have a stroke and they are supposed to be able to identify the symptoms, you have to quickly report to the hospital. And this time, I'll say that you have to quickly report to Komfo Anokye Teaching Hospital, because whatever we need to do for you is time dependent. The earlier we do it, the better. So most of the time, you want patients to report at least within 2 hours from the onset of symptoms. So when we get these patients coming in, what we normally do is that we have to assess the patient at the triage unit. Triage, we're going to assess the patient, and we have highly trained nurses who are part of the team who are going to assess the patient, and they're going to also involve the doctors on duty to assess the patient's eligibility for stroke thrombolysis. So we have our assessment that we do. There's a checklist that we have to go through. So after assessing, if we realize that the patient will probably be eligible, we have to quickly arrange and do a head CT scan or a brain MRI, a brain CT scan with brain MRI for the patient. And from the time the patient gets to the hospital, we want to do the CT scan or MRI within 25 minutes. And after the head CT scan is done, we want the interpretation to have been done by the radiologist within 45 minutes from the time the patient came to the hospital. If we are able to achieve this, what happens is that the radiologist is going to give us a report, and the report is going to tell us or inform us for us to be sure that we can thrombolyze this patient.
Principal Advanced Emergency Medical Technician Summit Youth is the regional manager of the National Ambulance Service, Ashanti Region.
Our duty is to make sure that we get the patient as fast as possible to the Komfo Anokye or to the closest hospital so that the medicine can be administered to them to be able to reverse it as soon as possible. We are looking at within the first 1 hour, we should be able to get the patient from where they are to the hospital. There are instances whereby the patients are very far away, and then moving them can even complicate the issue. So we tend to also help in the way we can to make sure that we get the drugs to the facilities that they are to be able to administer these medications on them on time so that we can get the stroke reversed. These are the two numbers that you can always reach the National Ambulance Service. And when you're calling for this particular kind of case, just tell the ambulance service that, oh, my relative has just developed these symptoms. This one, we don't need to call for any clearance before we come for them. We come for them straight, and then we activate the stroke code.
Finally, let's hear the compelling story of a stroke survivor who has benefited from this treatment. He's an American who experienced a stroke 3 weeks after visiting Ghana.
I was only able to say yes or no, and I could not move in the ER. And so they administered the TPA, and next morning I was able to get my thoughts and that I wanted to say important words, and I was able to say them. I stuttered a little bit, but other than that, I got it out. And by noontime, I was doing pretty good. I could do a full sentence. And then about the same time, around noontime, all of a sudden, the arm and hand started working. And then one of the doctors came in and he said, "You're doing very well." And so he asked me to move my hand and arm. I was very able to do that. I was talking to him, but the leg, no. At that time, was not able to do anything other than very minimal movement of toes. Then about 5 o'clock, I went out into a private room, and I was going to put my leg up on a pillow, and I was able to do at least that, the upper muscle of the upper arm, or upper leg, and then by the next morning, I was able to totally move my leg.
This patient is currently doing really well and is back to work with no disability at all. If you or your relative happens to have symptoms of stroke, do not delay. Get to Komfo Anokye Teaching Hospital within 1 to 2 hours of symptom onset. Time is brain.